When we talk about strokes or cerebrovascular accidents, we need to talk about the optic pathways and how they affect the visual fields that you'll be assessing. I'm going to discuss 3 different common visual deficits that you will see when assessing stroke patients. Your patient may display hemianopia. This means that the patient will lose half of his or her vision in each eye, or one eye, or both eyes. To understand how this happens, you need to understand the neurovisual pathways.
I'm going to start out by drawing a couple of eyeballs here. Inside that eyeball, I want to draw the optic nerve. I'm going to go ahead and I'm going to split it kind of in half here between a green side and I'll make the other side blue. And a blue side. And that's just to kind of show the different sides. I don't know if that even shows up, that one's green and one's blue. And so anyway, we need to talk about the nerves here and how they're set up. Now this would be the nasal side, right? Because the nose is right in between there. Let me grab a black pen here and put nasal. And then the temple is over on the sides of your head, right? So, and temporal side, right? So now let's come here and we're going to take a look and we're going to show how the nerves come out. Now they come out in 2 different nerves, and that's why I drew them. Yeah, 2 different nerves that innervate the retina here, and that's why I hope I called that the retina. Did I call that the cornea? If I did, this is the retina in here. Right, so this is the retina here, right? And I've got it split in half. Just not, it isn't that way in our system, but so I got the blue side and the blue side. Now notice that I did the blue side here for the nasal, the green part there for the temporal. Now they come out here together like this, just like I drew them. And at this point here, where the 2 of them are traveling together like that, kind of encased and one together. So anyway, right up here, we call that the optic nerve. Right? That's this part right there. So then what happens is they kind of split apart. So it kind of comes back here, back to the back portion of the brain. You know, let's draw a little bit of a brain in here just so you can kind of see that that's what we're dealing with. Right? So better put something across there. So anyway, that's not what the brain looks like, but it gives us a place to draw our lines to. So it comes back here to the back portion of the brain. Now, let's do that kind of again over here. So that's what our temporals does. It kind of comes straight back. Now you notice they don't cross over. Right? Yeah, we're always talking about their nerves crossing over. Well, these here are some cranial nerves that do not cross over. Now, right in here, the part of the retina that is innervated by this nerve here does cross over. Right? So it comes and it does cross over. And they call this area right here, let me get my black pen, call this area right here, see that area? Call that the optic chiasm. And then you notice down here, they're kind of coming back together again and traveling with each other again. Back in that area, it's called the optic tract. And now that is posterior to the optic chiasm. The optic tract. Right? Let me kind of draw this a little bit better, just so you can kind of see that. Okay, so here we've got the brain, or we've got the eyes, and I've drawn the neuro pathways from the eyeball to the back of the brain here, where near the base of the brain, where the vision center is. So now, what we want to take a look at is follow the pathway of a beam of light. What color should I make my light? I've already used those. I'll see. I'm going to try this yellow here and see if it works. So let's say light. Can we see that? Yeah, you can see that pretty good. So let's say we have light coming in from the temporal side, right? That'd be your peripheral vision. So it's coming in through the temporal side, comes in, and now we know that actually you have a pupil up here and the light enters there, and our the fluid in our eye is real thick, so it will bend to that light and make it come down a little bit. You know, when light goes through water, it bends, so it makes it look like things bend. But anyway, I'm not going to do that. I'm just going to draw it straight through. So when it comes from the peripheral side, it comes and it crosses the eye and hits the nasal side of the retina, right? That's the big thing to remember as you try to figure these things out, is that this, the temporal vision, in other words, the light from the temporal side, crosses across the eyeball and hits the nasal portion of the retina. And so now it's going to follow that blue nerve, right? So this is the temporal portion. Follow that blue nerve. And it's going to register on the opposite side of the brain. And your brain is going to make sense of all this. It's going to put it all together so that you have a picture that makes sense to you. Now let's take a look here. When from our vision coming from the nasal side, right? So across the body, it's coming across this way. And it comes in here like this and hits the temporal side of the temporal side of the retina and follows this green one down. So it doesn't cross, right? It doesn't cross. So because of these odd pathways, we get some odd visual deficits. So let's take a look and see. Now, the way that they like to draw these is they like to draw them in circles. Now, this is the left eye. Now, something to let you know, normally when we're looking at the heart, and we're looking at all the lungs and things as we're looking at it, things on the left side or the right side of the body, right? Things on the right side, because we're looking at it in an anatomical position and like we're facing the body. Well, in this case here, where it's like we cut the top of the head down and we're looking down on it. So that's not that way. So the left side is over here and the right side is over here. And that's just the way it is. At least it is the way I'm looking on my board. I'm not sure how it's going to come out on this video. But anyway, so here's the left side, left eyeball. And then they will say the right eyeball, right? When we are evaluating the hemianopia, they'll kind of split it down the middle here. And now let's say that we have a stroke, and we get an ischemic lesion, and it cuts right here. Boom. Okay, let's see what's going to happen. Well, actually kind of obvious, right? We got light coming through here, right? The light comes down through here, hits the temporal side. Boom, it comes down, it's blocked. Well, the light from the temporal side of our head comes in here, hits the nasal side, comes down, boom, it's blocked. So the left eye is not going to have vision on either half. either hemisphere of that vision. Both hemispheres have nothing. Now let's take a look over here on this side. Well, obviously, the light's going to come in here, hit this side, boom, come down all the way, and it's going to be able to be registered. The light's going to come in from the nasal side, boom, hit the temporal side, come down, nothing's there to block it. So, yeah, he's got vision, full vision, both fields in the right eye. Now let's draw another one down here and imagine a lesion. Got an ischemic lesion, we're going to say, in, I don't like that one. Not to be picky, but I want my circle to be a little bit more of a circle than that. Okay, so now, so that's up there when you have a lesion there in the optic nerve. Let's say you have a lesion here in the optic chiasm, right? So right there, right? This is 1. We're going to call this 1, right? 1. Now this here we're going to use over here is going to be 2. So this is 2. Right? So the light is going to come through here. Your peripheral vision is going to come through on the temporal side of your head, through the eyeball, and hit the nasal side of the retina. And it's going to come down on the blue one because the blue one carries the information from the nasal side of the retina. So it comes down here, the blue one, and we're not looking at 1. We're pretending 1 isn't there now. I don't want to erase it. I'll mess up my picture all up. But it's going to come, and it's going to hit this one because we're talking about a lesion right here in the chiasm. So it's not going to be able to be measured. So in your left eye, your temporal vision is going to be blank. Your left eye, your temporal vision is no good. Right? And in your left eye, let's see what your nasal vision is going to do. It's coming across here from the medial side, right, of your head. It's going to come across here in the nasal side and boom, hit the temporal side of the retina and follow that green line, right? Like again, 1 is not there. That's not the one we're talking about now. So I just don't want to redraw it every time I look in a different spot. So it comes down here, hits the temporal side, down the green one, and so it registered. So they have half the vision of this eye. They're going to be able to see everything on this side of the person, but he's not going to be able to see everything on this side of the person, right? So that's what happened. So right now we're done on this one. The left eye, that's good. That's how the vision is going to be. Now let's take a look here at the right eye. And if we follow it, if we're saying from the nasal side, vision comes in, right? He's looking up, the vision coming from that side of the person, and it's come through here, and it hits the temporal side of the retina, and that is carried down this nerve here, this green nerve that I drew. Comes down here, boom, and it doesn't run into any blockade. So the nasal side is okay, right? So the temporal side here, temporal side hitting the nasal side of the retina, and it comes down, it hits the chiasm, boom. So he has no vision from the temporal side here. So that's what he has, right? So he has lost his peripheral vision in both eyes. So he got tunnel vision. He can see right in front of him, but anything off to the sides he can't see because they come in and hit that blue nerve, right? The nasal side of the nerve of the retina, and hit the blue nerves, and those blue ones, right? The nasal sides are the ones that have to cross, and they can't cross because the lesion is right there, right? So that's number 2. Let's do one more. Let's do one more here. So let's go with 3. I gotta draw a couple more eyeballs, draw them a little bit bigger, I think. Okay, so let's take a look here. Let's say that we have a lesion, and I'm going to draw that lesion. I'm going to draw it over here just because I should have been drawing them on that side. That side's getting so cluttered. Let me get rid of these two here, or these ones here, just because I think they might kind of confuse some of you. Okay, so got rid of the other lesions. I left the 1 and 2 there so you remember where they were. So now let's take a look here. Let's do this evaluation all over again. The lesion is posterior to the optic chiasm now, and it's affecting the optic tract. So let's take a look at this. We'll start with the left eye again. His peripheral vision from the temporal side of his head comes through. It's the nasal side of the retina, and it comes down like this, boom, 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 and it's blocked. So his temporal vision is no good in the left eye, right? He's blind in the temporal vision of the left eye. Now let's take a look at his medial, from the nasal side. It comes through here, boom, hits the temporal side of the retina, and it comes down, and it's okay. So this eye, we're done over here. Now let's take a look over on this one. So we're looking at the right eye now. Let's start with his medial side. It comes down, hits the temporal side of the retina, comes down, boom, it's no good. So the medial side is blind on the right eye. And now let's take a look here at the temporal side, right? So let's take a look here. It's coming in, his peripheral vision is coming in the temporal side of the head, boom, hits the medial, or it's the nasal side of the retina, choom, comes down, and it goes over to the other side, so it gets processed. So when you have a lesion back here, that's what you're going to have, right? Now, obviously, if that lesion was over here, you would have the opposite, right? Yeah, when I say opposite, I mean they would be like flipped over, right? It doesn't matter. If you wanted to do it, you can make one in the opposite and trace it out. It just same kind of a deficit, really. There, that's a little better, isn't it? Okay, so that is how these work, right? That is it. So if you have a lesion up here in the optic nerve, it's going to, whichever side it's on, it's going to completely blind that eye. And if you have a lesion in the chiasm, this is what you're going to get. Both your peripheral vision is going to be lost. They're going to have tunnel vision. And if you get it posterior to the chiasm, this is what you're going to get. You're going to be able to see your you're going to have your visual field intact on one side of each eye, and you're going to be blinded in the visual field of the other side of each eye, right? So that's how they work, and you'll definitely want to know those things.
So that's the basics on the optic pathways from the retina to the visual centers in the brain. Hopefully, after knowing the pathway, you can recall this knowledge when you assess a patient with specific visual field deficits. When a healthcare professional is baffled by the assessment findings, that professional tends to doubt the findings. Even if that person does not remember the details of this lesson, just the fact that there is a memory that a patient may present with hemianopsia will give confidence that the assessment is a good one. This helps the confidence of that particular healthcare professional, and it helps patient care.